Information that we want to share with you today, and we also have a very special guest. San Diego native and Charger great Rolf Benerska is going to have an opportunity to share a campaign that he's put together with some of his friends. We'll have that right after the questions are presented. In addition to Rolf, we're going to hear from Supervisor Fletcher with an update on the numbers. We also have with us Sheriff Bill Gore, who's going to give us some important information about a recent Judicial Council ruling regarding the coronavirus and our jail population. And then we'll get a medical update from both Dr. Wooten and Dr. Efantides. We'll get started right away with Supervisor Nathan Fletcher.
Thank you, Supervisor Cox. Let's jump into our numbers for today. We are reporting 82 new positive cases in San Diego County. This takes us over the 2,000 threshold to 2,012. On testing, we're reporting 836 new tests reported. It takes us to 27,884 total tests. The spread between total tests and positive cases, which you can see on the next chart, remains consistent at about 93% of those reported to us are coming back negative. The next one here just simply reflects the number of positives we already reported. The estimated recovery at 789, again, that's an estimated recovery based on a 14-day time frame after they tested positive, adjusted for any loss of life. But that represents an increase of 108 from yesterday. Hospitalizations at 488 is an increase of 38. ICU is an increase of 9. And the unfortunate loss of life today is an increase of 7. We will go into our motel rooms. Very little change here. Slight decrease in the public health rooms in terms of the number of occupied, slight increase in the number of guests. Both of the categories on the Regional Task Force on Homeless Rooms represent a modest increase. Outreach efforts continue. 211 calls are up. Nursing call lines are up. EPI calls are up. Relatively flat around hygiene kits, hand washing stations, and toilets distributed. Our efforts around distributing personal protective equipment continue. You can see an increase in every category yesterday to today, minus goggles, which remains flat. We are now at 2,065,895 individual items of personal protective equipment from this list that have been distributed. This does not encapsulate a number of smaller items that we also distribute, but our efforts around this continue. And our ventilator report for today is 22 of 23 hospitals reporting at the time we prepared today's report, for a total of 531, 93 in ready reserve at the county to be deployed as needed, with the others that are being serviced are pending requests to the state along with those that we have ordered. That concludes my report today. I'll turn it over to Sheriff Bill Gore to give you his update.
Thank you, Nathan. I want to talk a little bit about an order that came out of the State Judicial Council on Monday. But first, I want to give a little background on what we've already done in our jails to set the perspective for you. Back in the end of February, anticipating the spread of this coronavirus around the country, we started looking at our very vulnerable jail population and realizing our responsibility to take care of them. We started looking at how we can lower our population in our facilities for two reasons. Primarily, one, to create space so we could do isolation cells should it be necessary in our facilities, and also to do the social distancing, which is not really feasible in a jail, but we want to do it to the extent possible. So we started off by modifying our booking criteria and taking a lot of the misdemeanors that were booked into our facility and making those cite and releases throughout the county to bring our population down. We also requested and received from the presiding judge here in San Diego the ability to look at inmates in their last 30 or 60 days of their sentence and reduce those and release those inmates early. We also, during this time, looked at implementing a pretrial bail review and trying to see which inmates were in our custody that we could lower their bail or put them out on their own recognizance. We released a lot of inmates there, and foremost in our mind in doing all these early releases was looking at what's the best to keep San Diego County safe, plus protect our employees in our jails and the inmates that we're responsible for. When we started that process, we were at 5,600 inmates. At the end of yesterday, I think our population was down to 43, 45. That's a reduction of over 1,200 inmates in our facilities, or a reduction of 22%. In addition to lowering our jail population to create space in our facilities, we also looked at enhancing our capabilities to keep people that might be infected with the coronavirus out of our facilities. We did that by enhanced screening of all inmates at intake, and looking at creating these isolation wards. Anybody that might be symptomatic, we had the space now to put them into isolation. Also, we restricted dramatically any visitors into our facilities. Now there are no visitors, as a matter of fact, and we have no contractors coming in to our facilities to provide the rehabilitation services that we've been known for around the state. So between lowering the inmate population and severely restricting the and screening for people coming into our facility, I'm really happy to report we've only had 3 reported cases of coronavirus in our facility. 2 have already been released and are on to their residence, and 1 is still in our custody. What happened Monday is the State Judicial Council, which is the Supreme Court's way of issuing orders around the state of California, issued what we call a zero bail emergency bail schedule. That means that anybody in jail in San Diego County, not San Diego County, but actually throughout the state of California, that's not in there charged with a serious or violent offense is required to be released by 5 o'clock today or as soon as feasible with zero bail. We looked at what the people we've already released from our facilities, so our number was a little bit lower than I thought it was going to be. Right now, we have about 500 people that fall into that category in our facilities that are not serious or violent and are pretrial inmates. Also on Monday, the presiding judge of San Diego County, Judge Lorna Oxley, issued I guess you would call it an implementing order that stated that these inmates would be released on zero bail unless the prosecuting attorney, the district attorney in San Diego County, advised the sheriff that she will be requesting an increase in the bail amount. I've talked to the district attorney on multiple occasions. She anticipates asking for somewhere over 100 cases of increased bail. We have a deadline. The court's issued a deadline. The DA will work on trying to get an agreement with the public defender or the appropriate defense attorney to come to some kind of an agreement, and they have to be in front of Judge Oxley or our judge here in San Diego County by the 20th of April. The way it looks like now, I anticipate by close of business day or over the next day or two, releasing another approximately 400 inmates from my facility on zero bail. So I think we did a good job. I don't like state mandates that treat everybody the same. I think when you look at San Diego County, we've done a responsible job of lowering our inmate population, and I'm concerned with a one-size-fits-all coming out of the State Judicial Council, and I know both the district attorney and I expressed our concerns in a letter to the Chief Justice. So I'll be happy to answer any questions later on.
Thank you, Sheriff. Before we bring up Dr. Wilma Wooten, I just want to add that out of today's positives, it includes 1 additional homeless. We're in the process of adding that to our regular charts, but wanted to provide that clarification. I'll now turn it over to Dr. Wilma Wooten for the Public Health Officer's report.
Well, thank you, Supervisor Fletcher, and good afternoon, everyone. I would like to start again with thanking all of our San Diego residents and organizations, businesses, and governments for doing your part to stay home, and when you leave your residence for essential reasons, to please cover your face in the public. April is continuing to be a vital month to help decrease COVID-19 cases in our San Diego County. And I think everyone is doing a great job, and we need you to stay the course. Regarding global, national, and state statistics based on data from the Johns Hopkins dashboard that was obtained today at 12 p.m., globally, we've reached another milestone with over 2 million positive cases worldwide, and this includes almost 133,000 deaths. Nationwide, there were almost 615 positive cases reported, including just over 27,000 deaths. And statewide, there were almost 26,000 positive cases, which includes 804 deaths. Today, for the County of San Diego, we have reached also a milestone, reporting over 2,000 cases at 2012, which is 82 more cases than yesterday, as well as 60 deaths, which is 7 more than reported yesterday. Of the 7 additional deaths, these include 1 female who was 100 years of age, 2 females in their 80s, and 4 males in their mid-60s, mid-70s, late 80s, and mid-90s, respectively. All had underlying medical conditions. Of the 2012 cases, the age range remains at 3 months to 100 years of age. 998, or almost 52%, were between the ages of 20 and 49 years of age. This percentage remains constant. 989, or 49%, are female. 1,017 are just over 50% are male, and 6, or approximately 0.3%, had no gender identified. 488, or 24% of the cases, have been hospitalized, and this includes 173, or approximately 8.6% of the total, that have been admitted to the ICU. This ICU number also is 36% of the total number of those individuals hospitalized. Lastly, the 60 deaths represent 3% of the total number of cases. Of the 60 deaths, 44.7% were female, 55% were male. Regarding race and ethnicity of the deaths, of the 60 deaths, we have data for 46, which is 77% of the total number of deaths. Of this total, 24 or 52% are white, 17 or 37% are Hispanic or Latino, 4 or almost 9% are Asian, and 1 or 2.2% is of multiple races. None of the cases, again, who have died were Black or African American, Pacific Islanders, or American Indian. So our sincerest sympathies and condolences to the families of those new cases from the county goes out to the family and friends of the announced deaths today. As a reminder, this information, in addition to race and ethnicity for deaths, but also for the overall number of cases, can be found on our website, which is www.coronavirus-sd.com. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative number of 33 confirmed outbreaks, which is 2 more than last reported. These include 20 outbreaks in congregate facilities, representing 182 cases and 22 deaths. 1 of the 20 congregate facilities is now inactive, so we really have now 19 active congregate facility outbreaks. 13 outbreaks in community setting locations, which includes 2 new outbreaks and represent 51 cases and 1 death. Regarding testing, as of April 13th, county hospitals and commercial laboratories have conducted 27,884 deaths, which includes the current total of 2012 positive cases, which still is 7% of the total number of all laboratory tests. And I'd also just like to share with you the federal priorities for testing, and they reside in 3 priority areas. Priority 1 is hospitalized patients and healthcare facility workers with symptoms. Priority 2 includes patients in long-term care facilities with symptoms, patients 65 years of age and older with symptoms, and patients with underlying conditions with symptoms, as well as first responders with symptoms. Priority 3 includes critical infrastructure workers with symptoms, healthcare facility workers, and first responders, individuals who do not meet any of the above categories with symptoms, and lastly, individuals with mild symptoms in communities experiencing high number of COVID-19 hospitalizations. San Diego is testing individuals in priority 1 and 2 and most of priority 3. And our county public health laboratory director is working with hospital, federally qualified health centers, and commercial laboratories to look at opportunities for meeting the full capacity testing in San Diego. Lastly, today I am excited to announce the Central and South Regions 2020 Live Well San Diego 19th Annual Public Health Champion Award recipients. This year's Central Region recipient is Logan Heights Community Development Corporation, an organization that strengthens residents and businesses in greater Logan Heights neighborhoods through community empowerment, education, economic growth, and housing development. The organization was established in 1995 by members of Bethel Memorial African Methodist Episcopal Church and is currently led by Monty Jones, a member of the Live Well San Diego Central Region leadership team. This year's South Region recipient is a Reason to Survive, an organization that engages youth to realize their full potential through the transformative power of creativity and arts, established since 2001. A Reason to Survive is a member of the Live Well San Diego South Region leadership team and is committed to innovative and trauma-informed approaches with the goal that young people will gain the skills, experience, and confidence to navigate life's challenges, cultivate positive relationships, thrive in modern workforce, and build healthy, inclusive, and equitable communities. For these reasons, I am pleased to announce these two organizations as this year's recipient of the Live Well San Diego 19th Annual Public Health Champion Award. Again, I cannot thank the public enough for staying the course, to stay at home, to decrease the spread of COVID-19. Everyone is making a tremendous sacrifice, and I continue to be encouraged that our collective efforts are working. Now please welcome Dr. Nick Ifantides to the podium.
Thank you so much, Dr. Wooten, and congratulations to all of our public health champions. Fellow San Diegans, we are blessed to live in a region that has world-class health care available to us, and they are here for you. You know, over the last few weeks, we have been repeatedly emphasizing the importance of appropriate utilization of health care services, especially in the emergency room. We have done some phenomenal innovations as a region, including, if you would, a complete on-the-fly redesign of our healthcare delivery system, in that the capacity for folks to do virtual telemedicine consultations, the availability of individuals, even without a doctor, even without health insurance, to be able to call 211 and to be able to get needed connection to a nurse advice line and so forth, are all tremendous accomplishments that we are thankful for and will likely in many ways continue into the future. But there is another side to this story that I just want to take a couple moments to emphasize this afternoon, and that is the following: that in some of my interactions with various emergency room physicians and emergency department directors in our region, there seems to be a little bit of a growing sense and an observation that some of the non-COVID patients, these are individuals that have health issues completely unrelated to COVID-19, are coming in potentially with a higher acuity of illness. And this is particularly concerning when it comes to cardiac issues and stroke issues and some pulmonary issues, where timely utilization of both 911 and emergency access is very, very important. So while we emphasize the message of the importance of appropriate stewardship, and for folks who have mild symptoms, we continue to emphasize the importance for you to be in touch with your healthcare delivery partners. If that's not available, call 211. But for those of you who are in need, please do not be afraid and do not hesitate to access health care, especially emergency health care. And one other reminder that we are seeing some early evidence of is that this is not the time for you to allow your refills and your medications to run out. Pharmacies are considered to be essential services. They are open for business. There are ways for you to have consultation with your physicians. It is critical that we do everything we can to maintain our health and well-being and to accordingly receive care in the right setting, at the right time, in the right way. Thank you so much, and with that, I will invite Chairman Cox back up to the podium. Thank you.
Thank you, Dr. Efantides. We're going to go directly to the calls now. Again, if you're not identified in your introduction by name and your outlet, please do that and then get right to your question. Let's go ahead and take the first call.
NBC 7 Telemundo, please state your name and question.
Yes, Gabby Rodriguez. I think you already said NBC 7 and Telemundo. We have been following the testing center over in Mira Mesa and received a document from the county where the county asked the place to close down. It is currently still open and operating. How does the county plan to enforce this closure that they've asked of them? And why was the closure asked of them?
Okay, Dr. McDonald's going to answer that question.
Yeah, I'll answer the question about limiting the services that they're providing. The COVID clinic was offering two services. One is a test for the virus, which is a nasal swab, which they are sending to a laboratory in Texas. And the other is a point-of-care test for the antibody, or a so-called a serology test. We worked with the individuals who run this clinic and asked them to provide some information to us about their CLIA certificate. That stands for Clinical Laboratory Improvement Amendment. It's a specific program that governs the quality of laboratory services. We asked for their certificate, the name of their laboratory director, and the laboratory information that they say they have that validates, that is, make sure it's useful, the test that they're actually using, that when it's a positive, it really means positive, and negative, and it really means negative. We have yet to get that information, so we issued an order asking them, well, directing them to no longer do that test. We did this in conjunction with the California Department of Public Health's Laboratory Field Services that actually has regulatory authority in this area. We're essentially acting as their enforcement arm because they don't have enough inspectors to go throughout the entire state. We brought this to their attention, and we're concerned that their rules and regulations weren't being followed according to state law. So we are working with the COVID clinic to get that documentation, and when they provide it to us and it is satisfactory, we will allow them to continue that operation.
So should they be closed right now because they're not? And how do you plan to enforce that right now?
Well, an enforcement question is better to go to a law enforcement agency. I'm a health care provider, so I can't really answer that specific question, but I can tell you they were directed to stop the specific activity of serology testing on site because that is where we have our concern, and I'll leave it at that.
So is there any reaction to the fact that they're still open? Anybody?
Well, I can tell you my reaction is that if I was in line waiting for a test, I would get out of line.
Okay, let's go to the next question.
Union Tribune, please state your name and question.
Hello, this is Gary Worth at Union Tribune. I had a question for Sheriff Gore. We had heard that some people said that sheriff's deputies had asked them, I think today, where they were going, if they were going to any, if they had a reason why they were out. And also, we understand that there was an incident in Julian where a deputy came up to a line of people who were outside of a cafe to get takeout, and were told to disperse. And from some videos that we saw, it did look like they were practicing social distancing. I wonder if you had could confirm any of that, or have you heard of any either one of those incidents?
Sheriff?
Thank you. On the first question you raised about, we are not stopping cars and asking people their destination. It's just not happening. I've had reports of that. I think some people might have got stopped for a traffic violation, and they thought they were being stopped for, to check for if they're in compliance with the public health order. That's not the instructions to our deputies, and they shouldn't be doing that. As far as Julian, this it's a recurring issue up there. We have Dr. Wooten here. I hate to interpret her public health order, but my interpretation of her order and what we're telling our deputies to enforce is that people are not to leave their homes unless they're going out for essential services, whether it's to go to the pharmacy, to the supermarket, to the pharmacy. Driving to Julian to get pie, as good as it is, and I love Julian pie, is not really essential. I remember 2 weeks ago we had car clubs and motorcycle clubs that were going up to Julian. You cannot put 1,000 people into that small town and really practice social distancing. So what our deputies have been doing is trying to educate the people on what the public health order says. I know we did issue some citations here in the last couple of days of people that just don't get it. And we've been in this for about a month and a half now, and we tried the education and voluntary compliance for a lot of those weeks from the beginning. Those days are really over, and I think that's what we're trying to get out to the public. Driving to Julian, because it's a beautiful little town, to buy pie is not really an essential travel, according to the public health order.
Oh, thank you. If I may, I had one follow-up on citations. So, one of how your department finds out about any violations regarding businesses that are open and they shouldn't be. We reported recently on some citations for, I think it was an adult business and some nail salons. Do those come in from complaints to 211 or any other tips? I was just wondering what the process was.
We have asked the public to report those types of violations to our non-emergency number or the non-emergency number with any local law enforcement agency in San Diego County, or to use 211. So they come in all different ways.
Okay. Oh, if I may, one more time. Supervisor, clarify when you said that the numbers include one more homeless person. Did that mean a positive test, or perhaps one of the people who passed away?
No, I meant one additional positive test.
Okay, thanks for clarifying that.
Okay, let's go to the next question.
10 News, please state your name and question.
Hi, this is Mimi Alcala. I just wanted to clarify with the COVID clinic question that was asked earlier. Were they ordered to only stop the serology testing right now, or have they been told to stop the nasal pharyngeal tests as well, if anyone can answer that?
Dr. McDonald will respond.
Well, we have specifically asked the college that is hosting them to no longer host their activities. That was the order that we provided, and by default, they shouldn't be doing either of those tests.
And then my follow-up question to that is, if they do provide the proper documentation test results to the county, will they be allowed to reopen and operate again?
Well, of course. If you comply with regulations, as stated, we'd be happy to let them conduct an activity that may be beneficial to the public. But that is what we are trying to verify, to be 100% sure that the service that they are offering provides the information that it should be providing.
And to follow up to that, as Dr. McDonald has pointed out, the college was told to not allow them to provide that testing anymore on their campus. If they disobey that, then I guarantee you enforcement action will be taken.
And Dr. McDonald, you spoke about antibody testing on Monday and how it's not too accurate. Should people just wait until an FDA-approved test is out instead of going to these clinics that are setting up drive-through testing sites?
Well, I think some of the drive-through testing sites in San Diego County have been set up in conjunction with laboratories in San Diego using the PCR test. So I want to make sure that we don't paint with a broad brush all drive-through activities as being of concern. In fact, I would say that most of the activities we have in San Diego meet the current definitions of what tests should be used, and we are working together with our local healthcare providers to make sure that all of the important safeguards are met to be sure that the tests are in fact providing the information that we ask them to provide. That's as far as the drive-through testing is concerned. And the other part of your question was what? I'm sorry. I just want to make sure I'm answering it.
The antibody serological test.
Right. You know, I think as I was going through on Monday that antibody tests are very important and will have an important role to understand who has been exposed and who is immune and who might be a plasma donor in the future as far as COVID-19 is concerned. But it's important to know the timing of the symptoms and the timing of the test to be able to interpret it. That's number one. And number two is some of these tests have to really give us the information that we want. What we want is, were you exposed to this specific coronavirus? There are other coronaviruses that may cause what we call cross-reactivity. That is, if you were exposed, say, to a coronavirus that causes the common cold, a serology test might actually just tell you that and not what you really need to know about this specific virus. And that requires some very sophisticated laboratory work. And the FDA has authorized laboratories to do this work and to use these tests under specific conditions, some of which lead to a emergency use authorization. I'm only aware of one of those such tests at this time, but the FDA maintains a list. And companies that are working on this now, including those in San Diego, are in fact working diligently on this problem and in fact providing the scientific evidence that's required to field these tests so that doctors can rely on them, and then eventually give this information to the FDA. The FDA is using some emergency authorities and powers to be able to get these tests out as quickly as possible to meet the need, but we don't want speed to get in the way of accuracy, and that's what we're concerned about with this specific COVID clinic operation.
Okay, we have one final call-in question, and then we'll go to the texted questions. Go ahead.
CBS 8, please state your name and question.
Hi, yes, this is David Gottfredson from Channel 8 News. I have received word that the clinic up in Cardiff, the drive-through clinic, has been okayed to operate through the end of the day. Is that your understanding? Also, why was it that the letter was sent to MiraCosta College and not the actual firm that is conducting the test? Is there some legal reason, or was it quicker for the county to order the college to shut it down as opposed to COVID clinic itself?
Dr. McDonald is going to respond.
Yes, I think, well, for the last part of that question, I think it was quicker for us to be able to direct the host of this operation to cease the clinic operations. And we have been in direct contact with the leadership of the COVID clinic, and they said that they would be ceasing operations immediately. So again, after this news conference, we'll be sure that they are doing so.
Actually,
Okay, just a quick follow-up. I just want to talk.
Sorry, I can't hear you.
Sorry, can you hear me now?
Sure.
Okay, sorry. So I want to just get some clarification on the FDA guidelines on this drive-through test site. Isn't the FDA encouraging companies to come out with these non-FDA approved antibody tests? And specifically in their guidelines, aren't they allowing for healthcare workers to administer these tests, non-FDA approved tests, at point-of-care drive-through sites like the one up in Cardiff?
Again, our interpretation of the guidance that's been given by the FDA and the guidance that we have received in direct communication with Laboratory Field Services in the California Department of Public Health is that the requirements that need to be met to do that activity without FDA approval or before they get emergency use authorization have yet to be met by this clinic. As soon as they meet them, we will be happy to let them continue their operations, but they need to meet what are essentially minimal conditions. Again, verification that this test does what they say it does in a laboratory here in the United States, and that they identify their laboratory director, and that they show us their certificates that allow them to be able to perform these tests.
Okay, I sent you some information on the actual test that they were using via email this morning. It seems to be that test has applied for a EUA from the FDA and that they have quite a bit of documentation. Does it appear to you that the test they're using is one of these that are allowed underneath the FDA guidelines?
Well, I didn't get an email from you. Actually, it's the company that should be sending the email to us. That's what I've asked for. And the information they supplied thus far does not satisfy our conditions to allow them to continue to do this test.
Thank you.
And I have a related question from Milo at Fox 5. If you can elaborate on the steps a private clinic administering tests would need to follow to avoid the same kind of shutdown.
Well, I think that they simply need to go to the CDPH Laboratory Field Services website and follow the rules.
And from Kelly at Fox 5, can you provide an update on antibody testing in San Diego? Will the FDA-approved test be coming to San Diego, and if so, when?
Well, we do know that some antibody tests are becoming available at some of our local healthcare systems, and the exact role of those tests in evaluating individuals who may have COVID-19 is important and requires medical judgment, which is why I think that it is important to put in the context that when a test is ordered, it needs to be, again, interpreted by a clinician with a very specific patient to understand what it means. So we do think those tests will become more and more available, and we are confident that our healthcare partners here in San Diego County will be, in fact, following the guidance from our state and federal regulators to be sure that when those tests are offered, that they are safe and reliable and can be used in clinical decision making.
Thank you, Dr. McDonald.
This is Dr. Wooten. I'd just like to add another comment to the, I guess is this reporter who asked, hasn't the FDA approved these tests? In March, the FDA issued a policy to allow developers of certain serological tests to begin to market or use these tests once they have performed the appropriate evaluation to determine that their tests are accurate and reliable. To date, the FDA has only approved one test, as Dr. McDonald has stated, and that is from Cellex, C-E-L-L-E-X Incorporated. So currently, while the policy has been issued that entities can begin to develop these tests, they still have to go through a process and receive the emergency use authorization from the FDA. So I just wanted to make that very clear. Thank you.
Thank you, Dr. Woot. We have a question from Taryn Mento with KPBS. Are there any other laboratories that you're monitoring or requesting additional information for possible violations?
That is the only entity to date that we have requested information from.
And a previous county at one of our news conferences included the CEO of Rady, who said the hospital's 3D printing lab could possibly be able to produce some materials needed for testing, such as swabs. Has the lab produced these or any other supplies for the county?
We have not, we are getting face shields produced through 3D printing, but not swabs to date. And I do know that Rob Seals is here. Rob, if you could address that.
Yes, thank you. The use of 3D printers, we are using, we're getting the bands and the face masks that are needed to produce these face shields from 3D printer sources through the county public libraries as well as private and other healthcare sources. We have yet to receive any of the swabs, but I'm working with our laboratory coordinator, Brett Austin, the director of our public health lab, to see what the needed supplies are so that we can take advantage of those 3D printed ones. So yes, thank you.
This next question deals with the cost of testing and when there might be some lessening of restrictions. Dr. Wilma Wooten will respond to that.
This is from Hunter from KUSI. We are reporting on a wide range of prices to get the COVID test, some as high as $1,800. What is the county's view of the cost of testing, and what can a person do to reduce that cost?
Well, first of all, the cost, any tests that are performed at our county of San Diego, there is no associated cost. And tests that are performed through the hospital systems, whether it is internal to the hospital or if they're using a commercial laboratory, that cost is typically borne by the insurance carrier. So, but we are concerned about pop-ups like the one that we've had a lot of discussion about here today, where there is an actual exchange, cash exchange, and we know that the PCR test was $125, and that the serological test was $75. So again, going through your healthcare provider, cost should not be a factor for the patient. In planning to provide the increased capacity of testing, certainly the systems have to worry about purchasing, but at this cost, we are purchasing different platforms to increase our capacity. And I'll just take this opportunity to let the public know that today, or actually yesterday, we received the Fusion or Hologic Genomics platform, which will allow us to run 500 tests at one time, about 1,000 in a 24-hour period of time. And then tomorrow, we will begin to set up the rapid test for PCR test for COVID-19. So not only is the county increasing its capacity, but the capacity is also being increased across the hospital systems as well. And next Tuesday at our Board of Supervisors meeting, we will report on what that capacity is.
And there's another part to the question. To your credit, the county is the 5th largest in America and has one of the lowest cases and death rate. Others, if they had these stats, would feel they'd scored a huge victory against the virus. Why can't you reduce restrictions now so some of the sectors can return to work and recreate with social distancing?
That's a very important question, and one that's being debated across the nation, and was the topic of this governor's press briefing yesterday. And we certainly understand everyone's interest in getting back to normal, but I can tell you, until we can have herd immunity that's created with the vaccinations, we will not be back to normal. And we are talking about how we can loosen up some of the various orders that have been imposed over the past month or so, and we will look at how we can do that. But as long as we have increasing numbers and increased numbers of hospitalizations and deaths, it would be premature to loosen up our social distancing strategies. We really, optimally, we would like to see after we've crested or plateaued, then see a decline before we loosen up. But we recognize that we will have to look at that, and hopefully at the end of this month, the month of April, and we've asked all of our San Diego residents to stay the course through the month of April, we will look at what conditions we can kind of dial down as opposed to what we were doing over the past month with the dialing up on the various social distancing strategies. So I would just tell you to stay tuned, and more is to come regarding that.
Well, thank you, Dr. Wooten. And that concludes the questions for today. But as I mentioned at the beginning of the briefing today, we have a very special guest with us today, and that's Rolf Benirschke. If there's anybody who probably doesn't need an introduction, it's Rolf Benirschke. He was a 10-year veteran with the San Diego Chargers and was really the person that was responsible for the Charger blood drives, and that got kicked off, and it resulted in, I think, the largest single-day blood donation in the history of the country. So we are honored to have Rolf with us today. He is presently the CEO of Legacy's Health Strategies, which provides leadership and patient engagement solutions for global pharmaceutical and medical device organizations. I want to acknowledge that Rolf is here really through the efforts of Dr. Nick Efantides, who is a personal family friend, and we are delighted to have Rolf with us here today because he's been working on a project of his own, which is hashtag Stay on the Bench, and he's been working with a lot of his friends in the sports area to put together an effort, and I wanted to call up Rolf at this time to tell us what he's been up to. Rolf?
Thanks, Chairman Cox and everybody else here. This is a privilege to be here. Before I get started, I need to express, really on behalf of the community that you are protecting so well, our thanks. We sit at home quarantined, frustrated, but we're safe. We're one of the top counties in the country in the way we've preserved the spread of this virus. So thank you on behalf of all the citizens. It does lead to why I'm here, which is really, again, like so many of us in the community, sitting here wondering what we could do. And it's been phenomenal to see how our community has responded. People are donating money, they're dropping food off, they're paying for dinners for the healthcare workers and doing everything they could. And so one night, a couple of days ago, saying, well, what can we do? And so came up with the idea of creating some selfies from San Diego sports legends and encouraging all of us, you, to continue to listen to the experts that are in this room that you just heard from, remind us about the importance of social distancing, wearing a mask when we're out, not going out unless it's for essential reasons. Even though it's hard, we have to do that. So I just sent some emails, called some friends, and the videos started to come in from the greats of our San Diego past. And so it sort of does two things. It spreads a very important message to get off the field and stay on the bench, which is hard for us athletes. But it also gives us an opportunity while we're at home to maybe reach back out to friends from college or high school or coaches or teachers that impacted us and actually get reconnected. So in the process of this, for me, the chance to call some old buddies that I hadn't seen in years always led to a half-an-hour conversation, which was incredibly fulfilling. So we wanted to share this message. It's just getting started. It's stay off the field, get on the bench. The hashtag is stay on the bench, SD. And what's happened is these videos start to just keep coming in and keep coming in. And we hope that at the time when we're sort of sports starved, this might remind us of some of our great legends in the past and what you've meant. But it also leads me to think of an analogy that I'd love to share. Some of you old enough to remember what we called the Epic in Miami. It was a great playoff game that became of lore, certainly in San Diego and even nationally. It's considered like the third best NFL game ever. That game I got to play in, and I will tell you, I remember it like it was yesterday. We jumped off to a 24-0 lead at the end of the first quarter. It's kind of like what we're doing here in the county. We are so far ahead of the rest of the country, it's unbelievable. We started looking around each other, goes, we're going on to the next round. We're going to get another playoff check, which was important back then because we didn't make much money. But what happened was Don Shula and the Miami Dolphins made a change, put a different quarterback in, and they started a comeback. And they made a comeback. And all of a sudden, the game had to go into overtime for us to win it. We don't want that to happen here in San Diego. We are way ahead. We are winning. We don't know if this is the first quarter, if this is halftime, if we're getting ready to enter the fourth quarter. But we need to maintain what the officials are telling us. Social distancing, masking, staying at home. Let them determine when we can come out and be free. We were all coached athletes. We knew our coaches knew best, and we won because of that. So I'm encouraging us to get off the field, stay on the bench, and I'd love to share, if I can, a little of the video clip that we put together of some of your favorite athletes here in San Diego history. Hi, this is Rolf Benerschka.
Hey, San Diego, it's Trevor Hoffman.
Hey, San Diego, this is Dave Roberts.
Mark Loretta here.
Hello, San Diego, this is Wally Joyner.
Brad Osmus here, former Padre.
Hi, San Diego, this is Buddy Black.
Hi, this is Ed White of the San Diego Chargers.
Hello, everyone. This is Phil Nevin, former San Diego Padre.
I'm proud to be a San Diegan. And right now, we need everybody in our community.
Experts are telling us for the next couple of weeks we have a hill to climb. We've got to, as much as we want to stay on the field.
Get off the field
and get on the bench.
In order for us to win this game, I need you to be on the bench.
Keep following the orders of the social distancing, stay inside.
In doing so, we're going to be helping all our first responders and medical personnel that are working so hard to keep everyone safe.
We're impacting their lives by staying at home.
If for any reason you have to go outside, please be responsible. Use masks, use gloves, and of course, practice social distancing.
Let's keep it going and keep safe.
Together, let's continue to grab some bench.
To protect each other, to take care of each other.
And we can beat this coronavirus.
I know we can, and we're going to beat this thing.
Let's do this, San Diego.
So that's, we put that together very roughly. The cool thing is the videos keep coming, and we're going to start to post them on my account, hopefully with the county, my Twitter account. We're going to partner with the San Diego Sports Association. You can see those videos in entirety. They're in anywhere from 30 to 45 seconds, that sort of thing. So we've launched the campaign. The response has been amazing, but we hope it sends the right message to stay on the bench for at least the near future. Thanks for having me, Chairman.
Thank you, Rolf, and we can't thank you and the sports greats from San Diego for your help in this campaign. Again, that's hashtag Stay on the Bench SD. Well, before we conclude, let me give you a brief update on the effort that we talked about at the beginning of April involving the Rock Church and Rady's Children Foundation. They joined forces to coordinate donations of medical supplies for our local health workers, and I wanted to let you know that they've been doing an outstanding job. In fact, they've collected 764 items, which include hospital gowns, lab coats, and other protective equipment. They've collected 11,006 N95 masks. They've collected 82,992 surgical masks, including 15 boxes of gloves, 140 face shields, and 465 safety glasses. Great job to Rady's and to the Rock Church in their effort in bringing in those personal protective equipment. And once again, thank you to all of you who've donated your pictures and your photos and your sayings to our campaign that we kicked off at the end of last week. We sincerely do appreciate all the people that have been hashtagging Stay Home San Diego with your photos. I think you're seeing some of those right now as we wrap this media briefing up. But keep those coming. We really do appreciate them, and we'll try to get as many of these on as we possibly can over the next few days. And again, going back to the Rock Church and the Rady's Foundation and Team Rubicon, who was also involved with that, if you have any donated medical supplies or medical supplies you'd like to donate, we would ask you to email donatecovid19@rchsd.org or call 800-258-0007. Once again, thanks to Rolf Benerschka and his sports friends. It was a great video. And their hashtag is StayOnTheBenchSD. That concludes our media briefing for today. We'll be back here tomorrow at 2:30. Thank you.